Okay, hi there, my name is Cayden Sutherland, and I'm going to be demonstrating my second pharmacology critique, IM and sub-Q injections. First, I'm going to go over the landmarking for each. So for intramuscular injections, the first place is the deltoid muscle. So you're going to put the palm of your hand on the deltoid muscle with your index finger pointing towards the anterior crest of the shoulder joint and the middle finger pointing towards the posterior crest. Deep inside the V is where you would put the injection into the deltoid muscle. The next spot is ventrogluteal. So you'll palpate the greater trochanter, put your palm on the head of the patient's femur while they're lying in bed, thumb pointing towards the groin, index finger towards the mid-axillary line. Deep inside the V is where you would do the injection. And then the last place is vastus lateralis. Divide your thigh into thirds, 1/3 up from the patella, 1/3 from the hip joint. In the middle third on the lateral aspect is where you would put the IM injection. Now for sub-Q, the first place would be the posterior aspect of the upper arm in this fleshy part right here. The next spot would be the abdomen from the costal margin to the iliac crest, 5 centimeters around the umbilicus. The next spot would be the anterior thigh. Okay, let's demonstrate an IM injection. So, for an IM injection, I'm going to use a 3 ml syringe, 0.7 millimeters by 40 millimeters. Okay, so I have that. I'm going to get my medication vial, snap off the top. If it's previously been used, I'm going to clean it with an alcohol swab, allow it to air dry, open the syringe package. I'm going to aspirate 1 ml of air into the syringe, which I will then inject into the vial. And then I will aspirate just over 1 ml of fluid. And then I will knock out any air bubbles. And then since I aspirated more than 1 ml, I'm going to correct the volume to exactly 1 milliliter, no air bubbles. I will recap with one hand doing a scooping technique, and then I'll show you. We're at 1 ml, no air bubbles, good to go. Into the patient's room we go. We'll prepare the skin. So for an IM injection, once you choose the site, you want a site with no lesions, no infection, no necrosis. You don't want to go into a large muscle, and you don't want to go into a blood vessel. So you will prepare the skin with an alcohol swab moving from the center out. Allow it to air dry. Don't blow on it. Don't wipe it with anything. Air dry. So the technique for administration is kind of like a karate chop. You Z-track. So you're going to hold the syringe in your dominant hand kind of like a dart, then Z-track appropriately. Inject at 90 degrees. And then once you're in, you're going to aspirate to make sure you haven't punctured a blood vessel. If there's absence of blood, you know you haven't punctured a vessel, so you're good to inject about 10 seconds for 1 ml. Then you're going to allow it to absorb. Allow to absorb for 10 seconds, remove the syringe, goes directly into the sharps bin, release the Z-track, gently massage, and then document appropriately. Okay, so now we're going to do a sub-Q injection using the tuberculin syringe, 0.4 millimeters by 13 millimeters. Again, we're going to do that nifty little trick where you aspirate 1 ml of air, open the vial, clean it if it's previously been used with an alcohol swab, allow it to air dry, inject the vial with 1 ml of air, and then we're going to aspirate just over 1 ml, just over 1 ml of fluid. Okay, and then we'll knock out the air bubbles. Once the air bubbles have been knocked out, we will correct the volume to exactly to exactly 1 milliliter of fluid. Recap using one hand and a scooping technique. We're good to go. Okay, I'll show you. No air bubbles. We're at exactly 1 mil. We're going to go into the patient's room, prep the site for injection using an alcohol swab. Going to make sure there's no infection, no necrosis, no non-in-contact skin, and that if we're doing it in the abdomen, it's within a 5 centimeter diameter of the umbilicus. No scar tissue, no lesions, that sort of thing. And then the way we do it, we're going to pinch the skin. This can go in at a 45 to 90 degree angle. If it's going in at 45 degrees, you're going to want to make sure the bevel is pointed up. We're going to pinch the skin. The needle should be 2/3 of the size of the skin that you're pinching, and then hold it like a dart, dominant hand, and then inject. And then insert 1 milliliter of fluid, slowly, 10 seconds for 1 mil. Allow it to absorb. Take the syringe out. Goes directly into the sharp spin, and we do not massage a sub-Q injection site, but we can apply gentle pressure if the patient is bleeding. And then we'll document on the MAR and sign the signature profile. And I think that is everything. Oh, sorry, I should have mentioned before both injections, I would have performed hand hygiene and donned clean gloves before each injection. And then I would remove my gloves once I'm done, again performing hand hygiene before leaving the room, and then doing the documentation, and then making sure those are disposed of appropriately, and we're done.